What defines a psychological disorder? This video delves into the complexities of defining, classifying, and explaining disorders. Explore how various models and systems aid in understanding mental health. This unit focuses on psychology at level 3 with 3 credits. It requires 2 essays totaling 2,000 words. You will learn about defining psychological disorders and classification systems. The unit is graded as pass, merit, or distinction. It emphasizes research and academic skills. The assignment aims to develop an understanding of psychological disorders. It explores classification systems and evaluates models explaining abnormal behavior. You will apply theory to real conditions and demonstrate research skills. The focus is on academic referencing and writing. This assignment builds a comprehensive knowledge base. You must answer 2 essay questions, each 1,000 words. Demonstrate research and critical evaluation in your work. Include in-text citations and a reference list. Follow academic writing conventions for clarity. This ensures a structured and well-supported argument. The first essay asks you to explain atypical behavior. You must describe 2 classification systems for such behavior. Evaluate their strengths and weaknesses. Distinguish between typical and atypical behavior. This question explores fundamental concepts in psychology. Typical behavior aligns with social and cultural norms. Atypical behavior deviates from expected patterns. Psychologists assess distress, dysfunction, danger, and deviance. Definitions of abnormality vary across cultures. Research establishes criteria for diagnosis. Classification systems organize mental disorders. The DSM and ICD are key examples. They provide diagnostic criteria for professionals. These systems ensure consistency in diagnosis and treatment. Such frameworks are crucial for effective mental health care. Classification systems offer standardized diagnosis. They facilitate communication among professionals. However, cultural bias can be a concern. Disorders may overlap or evolve over time. Subjective interpretation can influence diagnosis. The second essay involves explaining a model of atypical behavior. Apply the model to a specific mental illness. Discuss the model's key features. Evaluate its strengths and limitations. This question deepens your understanding of psychological models. There are various models of atypical behavior. The biological model focuses on genetic or neurological causes. The behavioral model sees disorders as learned through conditioning. The cognitive model links disorders to negative thought patterns. The psychodynamic model considers unconscious conflicts. Choose a mental illness like depression or anxiety. Explain how a model interprets the illness. Support your explanation with research evidence. Consider how the model informs treatment. Evaluate if the model fully explains the disorder. You will define normality and abnormality. Explore systems for classifying atypical behavior. Discuss issues in defining and classifying abnormality. Describe and evaluate psychological models. Apply models to named mental illnesses. A pass requires clear explanation and basic evaluation. Merit demands strong understanding with evidence. Distinction involves detailed evaluation and analysis. Work should show reasoning and insight. These criteria guide your academic performance. Each assignment allows 1 formal submission. Resubmission is permitted to achieve a pass if needed. It is not for grade improvement. Tutors cannot review multiple drafts. Your work must reflect independent performance. Read the assignment brief carefully. Plan your essay structure before writing. Use academic sources like textbooks and journals. Support your arguments with evidence. Accurate referencing is crucial throughout. Attend tutorials and ask questions about criteria. Seek clarification on command verbs like analyze. Ask for guidance on essay structure and referencing. Engage with support early before deadlines. Develop independent research and study skills. Normality aligns with cultural norms and expectations. Abnormality deviates from these standards. It involves distress, dysfunction, danger, and deviance. Definitions vary across different societies. Psychological research aids in establishing diagnostic criteria. Classification systems organize atypical behavior. The DSM and ICD are widely used systems. They offer diagnostic criteria for mental health professionals. These systems ensure consistency in diagnosis. They are essential for effective treatment planning. Defining abnormality raises several issues. Cultural differences can influence definitions. Classification systems may have biases. Overlapping disorders complicate diagnosis. Subjectivity can affect the classification process. Psychological models offer diverse explanations. Each model has unique strengths and limitations. They provide insight into mental illnesses. Models guide treatment approaches. Evaluating models helps refine understanding. Select a mental illness to apply a model. Explain the model's interpretation of the illness. Use research evidence to support the explanation. Consider treatment implications of the model. Evaluate the model's comprehensiveness. This video has explored key aspects of psychology. Apply these insights to deepen your knowledge. Psychology offers valuable tools for understanding human behavior.